India is set to suspend most travel to the country in order to control the spread of the coronavirus. The government announced it will be suspending the issue of tourist visas to India beginning midday Friday. So if you're planning a trip to India, here's a few things you need to know. Firstly, no new tourist or e-visas will be issued till the 15th of April. Existing tourist visas on which journeys are yet to begin stand cancelled. Foreign nationals with a compelling reason for travel to India need to contact the relevant Indian mission. And the other thing about this order is that it does not affect foreigners who are already in India and those with visas, nor does it affect diplomatic, UN official or employment visas. Now, the restrictions come as India reported at least 70 cases of the coronavirus in the country, most travel-related. At least 17 foreigners have also tested positive. The potential for a bigger spread already has people worried.
New Delhi's Janpat market is usually a popular stop for travel memorabilia. Now it lies deserted. Karan Markan squarely blames the coronavirus. In 6 years of running this shop, he has never seen a slump this big. Over the last 2 weeks, his sales have dropped by 80%. Tourists, both foreign and Indian, are steering clear of marketplaces like this one. For Markan, taking precautions can get in the way of keeping up appearances for the odd shopper who does turn up.
We have hand sanitizers for employees in the shop, but we can't wear masks, because if people see us wearing them, they'll wonder what's wrong with us. They'll think, let's stay away from him. And if tourists don't enter the shop, what's the point?
Some store owners, desperate for business, say avoiding travel and public spaces is unnecessary paranoia. But with scores of new cases reported across India this month, the Indian government is taking no chances.
India has revoked the visas of all foreign nationals till April 15th. Indians returning home from affected countries will be quarantined for 14 days, and authorities warn that even those coming back from other countries can be quarantined.
Though the onset of warmer weather means Delhi's chronic air pollution is finally clearing up, face masks are still everywhere. The surge in coronavirus cases has set off massive buying of both masks and sanitizers. Pharmacies are running out of stock.
People shouldn't buy multiple masks and sanitizers, so that others can get them too. Many are stockpiling these items, but they shouldn't do that. They should think about the others too.
As the government evacuates more Indians from affected countries, the total count of cases is nearly certain to rise. In Delhi, many residents are wary and are following all the protocols.
If the spread of the virus worsens, we'll have to stop going out. But if people take the right precautions, I don't think things will get that bad.
The government should hand out free masks and install sanitizer stations everywhere. They need to educate people about this disease.
As Indians wait to see if and how the coronavirus can be controlled in such a densely populated country, many are hoping the coming months will provide better news.
So what really are the Indian government's plans? DW correspondent Nimisha Jaiswal joins me now from Delhi. Nimisha, how exactly does the Indian government plan on tackling the coronavirus outbreak?
Well, Paresh, the Prime Minister has constituted a high-level group of ministers which is meeting regularly and reviewing preparedness and prevention measures across the country. India's focus is on prevention, and especially on the international front, because the 70-plus cases that India has seen so far are all related to international travel. India has suspended the visas of all foreign nationals. They are even blocking the entry of overseas citizens of India India who are usually able to travel visa-free. Even land borders are going to be closely monitored. They're actually restricting crossing over land borders as well. And they're also going to set up strict monitoring along these borders. Every Indian returning to the country can also be quarantined, and those coming in from specific affected countries will definitely be quarantined for 14 days. On the domestic front, the Indian government is trying to reassure people that things are under control. They have set up a 24/7 helpline for anyone who may have questions about the coronavirus, about their symptoms. There's also been an effort to reach absolutely everybody through caller tunes. Now, every time an Indian person puts out a phone call, they actually hear an informative piece for 1 minute about precautions to be taken to combat the coronavirus. And there's also the army and the paramilitary forces who are being called in to set up quarantine facilities, to set up isolation facilities, and testing and medical preparedness for teams on the ground is also being ensured. This is what the Ministry of Health is continuously putting out, especially over the last 2 weeks as the numbers surge in India.
Despite that, Nimisha, India's health sector is notoriously overburdened, especially when one talks about government hospitals in the country. Is there confidence amongst people that the government can really tackle this outbreak?
Well, Paresh, despite the very vocal and vehement insistence of the government that everything is being done to tackle the coronavirus, we cannot deny that India's healthcare infrastructure is notoriously weak. That India has actually amongst the lowest percentage of GDP spending on healthcare, and the ratio to doctors to patients as well as nurses to patients is terrifically skewed. That being said, one of the important things that influences public opinion on this is actually the messaging coming out from leaders. The Minister of Health today spoke in Parliament saying everything is under control and spoke at length about the measures that we just spoke about. And the Prime Minister has also been tweeting saying say yes to precautions and say no to panic. So the messaging so far from the government is that things are all right, and the voices we are hearing on the street are not yet of serious panic. Yes, there has been mass buying of masks and sanitizers, but people seem to believe that precautions will do the trick. You have to know that the cases are still under 100 in India, and already these restrictions are being deployed on travel and all of those other restrictions that have been imposed by the government. So people have confidence so far, but it would be interesting to see what happens over the next 2 weeks, especially if the caseload goes up.
DW correspondent Nimisha Jaiswal in Delhi. Thank you very much for that.